Hello, Don here. Welcome to Podiatry Practice Mastery. I'm going to go over another practice audit of a doctor that sent in some information. So let me kind of go over this with you here. Here is an example of the audit. I'm not going to give his personal information just because of privacy. He's doing this audit. He's been in practice since 1992. I ask these questions in the audit. What's going well in your practice? He's happy about having a good reputation, good word of mouth from patients in the community, longevity, and things like that. What areas of your practice make you excited? It used to be wound care, but recently it's been a shift. I'm not getting as many referrals. I'm not seeing as many wound care patients. What causes you frustration? Loss of sleep, finding the right balance to have a schedule full of the right kind of patients, but also having a well-trained staff ready to handle them. He's not been part of a mastermind or coaching. He personally produces from 500 to a million. I've changed now. I've changed it a little bit closer so I can know exactly what people are producing because that's a big gap. It's hard to really tell where they're at. He might, I don't know if he's closer to the million, closer to 500. Initially, when I was doing these audits, I was trying to be more conscientious of that, but I'm hoping he's closer to the million mark. He wants to get 1 to 3. What's stopping from moving to the next level is me, which is him, which I think that's for most of us. What's really stopping us is that. And what one skill would you like to have mastered? And that's selling high value services such as EPAT, dressing supplies, skin subs to patients who have out of pocket expenses. I think if you can learn one thing, this skill specifically to EPAT or Shockwave would really benefit. I asked some follow up questions from his staff, and he usually does one a month. So one a month is going to be hard. It's going to be hard. You're not going to have as much um, mass of patients coming in, and you're not going to get as confident and good at doing it. Who's your ideal patient? A patient who has done some research about their problem, visited the website, knowledge about their problem, and have an idea of what treatments to pursue. So I think this is true. I think as many patients that they can come in and they are aware of what we do prior to seeing us, it really helps things. And I like the idea of them going to your website. I like the idea of them researching about it so they're prepared. So the magic genie question is, if a genie gave you 3 wishes and you could change 3 things about your business instantly with no effort or cost, what would they be? Patients with good insurance, traditional Medicare and a supplement instead of managed care, a laser for pain, toenails and warts, and better computers. So we can address these. So I think patients with good insurance, so the way you get good insurance is you opt out of the bad insurance. That's what I would say. So number one would be opting out of Medicaid, and then or any low paying insurances. I think that's how you get good insurances, is just reducing the other ones. But the problem is if you don't have enough patients, you're going to be starving while you're doing that. A laser for pain, toenails. My personal opinion, I think I don't do much pain or toenails with my laser. I don't, depending on your if you see it successful, it should be easy to do that. But if like for me, I struggle with having it really work for pain. I think Shockwave works much better. I guess having a laser for warts works. It's less expensive than a Swift, but it works well. It hurts a little bit, but we have a Qterra that we do, and then better computers. That's always a challenge I find. We spend an exorbitant amount on computers in our office and technology, and you really just have to have an outsourced technology team. That's what we have, an outsourced. It's called Microtime. That's the one that we use, but they really just, I think they're always changing our computers. They do it every 5 years, and I think it's too soon, but they say it's necessary. So personally, he's doing an 8, which I think is good. Professionally, he thinks he's doing a 9, so that's good. So maybe he doesn't need much help based on this audit. If we're looking back a year from now, would you make you happy with progress, a million in collections? But truthfully, I would need to get better at being present and paying attention to details to make this happen. It seems like he's being pulled in a lot of different directions. And I think a lot of times when we're in the office, we're not really on. We're distracted, multitasking, doing other things between patients instead of really being there for the number one thing is providing good quality care to patients. So I've asked some follow-up questions. I'm going to go over this a little bit. These are my suggestions, but these weren't filled out by them. The procedures that he does in the office, he does flexor tenotomy, I&D, matrixectomy, skin subs. But really, I think there's a lot of room for like shockwave, scanning for orthotics is low hanging fruit, um, things like that. So he's a lot of other things. He has PRP injections for wound care. What he'd like to do more, flexor tenotomies, right? Those are easy to do for like flexible hammer toes. Orthotics, I think the key for what the mistakes I've made in the past is I had a company that had a lot of returns. If you have a lot of returns, or if you don't get good results with the orthotic company, the problem might be the orthotic company, not you. So you have to get a company that has good orthotics that there's few returns. That's what I found. So then you can be confident offering them to all patients because they're not gonna be dissatisfied. Shockwave is kind of a long conversation, but getting confident and having a way to offer it, I think the best way to offer it, in my opinion, is with ultrasound to show the thickness of the fascia and just being confident. And really, the best way to get confident, I think, is going to one of these shockwave courses. There's a lot of courses out there. Curamedics has one, and there's an American Shockwave Society, which are great conferences where you can get more confident, or even go and visit other doctors that do it. I think that would be beneficial. And then PRP, I don't do a lot of PRP. I do amnio. Once again, I do it a minority of the time. Um, so he doesn't accept Medicaid, which is good. He has a couple of things that he offers: antifungal shoe spray, correct toes, pads, post-op kits. There's a lot of others that could be added. He does a lot of CBD and EBM. What would you like to start doing? I'd like to start doing all of it. I think adding too many things at once can be overwhelming, but adding some strategically into your treatment protocols would be good. Non-custom DME that he does ankle braces, diabetic shoes, posterior night splint, tall walking boot. So maybe you could add a short walking boot. I think this is a good selection here. And then in terms of custom, he doesn't do any custom. Or maybe he does, maybe it just wasn't filled up, but not a lot of custom DME. It's pretty easy to do these Ritchie braces for PTD. For if you're seeing a lot of wounds and diabetics like he is, it's probably going to be easy to do some balance braces, things like that. So he'd like to do more braces, AFOs. I think everyone would. A lot of it is just finding the right patients for those. Like, and I usually do it like for PTTD. It really helps ankle sprains, things like that. You're going to be doing these custom braces along with other types of treatments. Efficiencies, he has Plod AI, Morning Huddle, which is good. What would you like to start doing? SOPs, standard operating procedures, and then Amazon affiliates. Amazon affiliates is a good idea, but really I like to carry things in the office that Amazon doesn't sell. I might refer to certain things on Amazon, but really you don't earn anything on Amazon. I guess he has a system for online reviews, things like that. He'd like to do more YouTube videos. My tip for YouTube videos for a busy doctor is to have one of your staff record you as you're talking to a patient. So it doesn't show the patient in there, it shows you doing your spiel. I think that's the best way to get a few good videos is have a staff with you one day just recording you and saying, is it okay if I record how he explains things? That's the easiest way. If you're more high tech, you can do that. That's beyond that. Social media posts, once again, then you can take these videos, turn them into social media posts. Shockwave, and then getting more reviews. I like Swell, SWELL. That's my favorite for Google reviews right now. It's just an automated system. So it doesn't really have EMR stuff in here. Orthotics 515, which I think is adequate for orthotics. Not offering a second pair. I find the best way of offering a second pair of orthotics is having it in when you give the orthotics out. It has a little coupon in there for whatever you want to give. We give $200 off the second pair. Shockwave, he charges $150 per session, offers usually 3 sessions. So I would suggest increasing the price if you feel confident. If you're only having radial shockwave, I think we used to do 200. Now we have radial and non-radial. We do 250 a session, and patients gladly pay that. I think he was doing 3. I think when I looked at the follow-up questions, 3. I find, when you do 3, I just had sometimes not the best results, and I would have to do more. I find by doing more by week 5, they start to feel better. So I like to be present when they're there, when they're doing 6 of them. So he's not doing amnio, not doing Swift, not doing fungal laser. And I talked about some of the packages that I have. We didn't really talk much about that. I may have changed this audit a little bit before he filled it out. So he is every day in the clinic. Looks like patient clinic hours, Monday through Thursday. And then Friday, Saturday, Sunday, he's off, which is good. So he's only working 4 days instead of 5 days. He does 15-minute appointments for everything, double book follow-up appointments, and tries to keep new patients spaced 30 minutes to 1 hour apart, but not always possible. So I think that's a good patient flow. So his numbers, so I'm going to compare my numbers. So his numbers, he did 66 new and 285 total, which I think that's a pretty good number. So if you look at it, he's seen 285 and he's only working 4 days. I'm working 5 days. I'm a little bit higher than him. 359 in February and 368. So I think for this doctor, the problem it's not a patient problem. There's not a lack of patients. It might be the type of patients. It could be routine heavy. That's the challenge. So, and I don't know, I'm not exactly sure if these numbers are correct, but if you divide things out, he's saying it's about 301 per visit, 296, 320. So like that's better than mine. So I'm not sure if that's really correct. But if it is, that's great. He's probably doing much better than I am. He would be over the $1 million mark if he was actually producing 300 per visit. Okay, that's the way I see it. No fracture codes. No, he does a diabetic foot exam. Nail care, it's too high. I do not have 1 day a week. They're all booked all over the week. He finds other problems. Okay, so that is the that is this here. So I'm going to go over a few other things that he put in there. I just don't want to expose this doctor. So he doesn't really ask for Google reviews and things like that. And I asked to clarify a few things, and they sent me a few clarifications here. So he actually has one practice. He's part of a group with 17 podiatrists in 17 locations. And he's a solo practitioner, but he co-owns 3 other offices. So the out of the 3 offices, one's a powerhouse. It's doing better than the other. The other 2, they have 2 podiatrists managing the 4 locations. Their per visit value is close to 250 for one, but less than 200 or less for the other doctor. And they're only seeing 130 to 145 patients per month. So it sounds like in his practice, if he's seeing the 300, he's seeing tons of patients. So it might just be that they're not valuable patients. He's not producing enough revenue. Or if he really is producing 300 per visit, that's awesome. But I don't know, he would be over the $1 million mark already. So, and then the other offices, they're 130 to 145. When you're down with patients, like the whole focus isn't on producing more, it's getting more butts in the seats. So you have to spend all your money on getting more people in the seats. Okay. One way he could produce more would be doing more shockwave. He only does about 1 per month. And that is if you're seeing plantar fasciitis and Achilles tendonitis. So offering that. My favorite tip for shockwave is you do the first visit, you start the initial treatments, which would be an anti-inflammatory contrast bath for reducing inflammation, night splint, foam rolling, and morning stretch, where you prescribe a night splint, and then giving shoe recommendations and maybe UFOs for sandals. If they're not better in 3 weeks, I see them back. I have them do an ultrasound. And if I see inflammation on the ultrasound in little micro tears, that's where I recommend the shockwave. And the main phrase that I use is it's 82% effective and it speeds up the healing by 50%. And I tell patients we do 6 sessions and they're usually about a week apart. I like to get the 6 sessions in within an 8-week period. And there's really no objections. And so what happens after 6? So like after 6 weeks, they come in 6 weeks later. And if they're still having a little pain, I will do another shockwave and I don't charge them. Okay. Then I see them 12 weeks after, and then I'll do another shockwave if I need to, and I don't charge them. So I'm not charging for any additional ones. And I find that method really, really works for getting patients better and getting them results. And they feel like, okay, they know the plan and they know the cost. And I just find it more effective than cortisone, because cortisone makes them feel better, but a lot of times that pain comes back. But for certain ones that can't afford it, that can be a challenge. But where I'm at, he's doing 150 a session. I would say you should set up multiple. If you're seeing that many patients, you could set up multiple shockwaves each week. My best method is using something called a treatment sheet, which has all the treatments on one page. I just can't emphasize how much that helps. It makes it a lot easier. So once again, if you're listening to this and you want my treatment sheets, you can just email me, don@podiatrypracticemastery.com, and I can send those to you. For like, you tell me what diagnosis and you can try it. I would just say try to use it. So that would be my best method for shockwave. He's doing also, he has a nail tech, or at least I'm sorry, a suite next door where they do a medi spa. I think that's great for doing like Onifix, Cariflex, medical pedicures, things like that. Um, and then he does a little bit of EBM as well. He's doing different types of DME and AFOs. He's not doing as many AFOs. And then he's doing some marketing specifically for orthotics. So it's hard for me to tell based on this audit whether or not it's a volume problem, because it seems like there's enough patients. So it's most likely a per visit value problem, like how much he's producing per visit. So with helping that's a whole other discussion. But I always say, how do you reduce low value patients, meaning low profit patients, and increase higher value patients? And I think number one would be putting all the routine on one day. That really helps us, or a half day. And you're going to be like, what am I going to do with all the other time? Well, you have to get other patients in there. Okay. That would be one issue. And then if the whole problem is you're not getting enough patients in, it's not a profit problem. It's about getting patients in. But basically looking at the numbers, it looks like there's enough patients there. So I'm not exactly sure. I know referrals have gone down, but if you're seeing 300 patients a month, that's pretty good. It may be more of a per visit value patient problem, or not seeing the type of patients that you like. Okay. So I hope that is beneficial. Once again, if you guys want to learn more, let me know. On podiatrypracticemastery.com, we kind of go over these things. There are periodic times where I'm doing webinars. I'm doing one shortly about this topic specifically, how to produce more revenue with each patient. If you want more information, go to the website and you can learn more. Okay, thanks.